And we're going to talk about long COVID. So, good evening, or day, or night, or whatever it is when you actually get to see this. And we are going to explore like what is long COVID, some of the symptoms, its effects, how it's managed. So, we'll see what we got here. All right, so long COVID, also known as, so I'll do my best here, post-acute sequelae of SARS-CoV-2 infection, or PASC. So it refers to a wide range of symptoms that continue for weeks or even months after the acute phase of the infection has cleared. So some of these symptoms, I've got these all listed up here, but they include fatigue, shortness of breath, and cognitive issues, also kind of known as brain fog. And I've actually heard a lot of people in my area that have expressed some of these symptoms and everything like that. Also some chest pain. Some of the other things are kind of like your sleep issues. Let me get my little laser pointer. Sleep issues, headaches, heart palpitations, loss of taste or smell has been a big one, and more. I actually had a buddy that he would just smell cigarette smoke so strong, and it'd just be at random times. Like when he's in his home, he's not a smoker or anything. Nobody in the house was smokers, so it wasn't like secondhand stuff or anything. And it just overtake his senses, and it was kind of annoying and hard to deal with for him. I should ask him if he still has some of those things or if it's finally kind of phased itself out. But where the initial 2020, it's been almost, it's been 4 years since the initial pandemic. It's crazy that there's still some of the lingering effects. And so, even years later type of thing. And again, there still is the infection that comes around. It's just not as severe as what it used to be. All right. So who's it affecting? Who's at risk? So people of all ages, really, and even people that haven't had severe reactions with COVID-19, but even kind of some mild symptoms and everything like that. So older adults, people that had severe COVID, and individuals with underlying health conditions seem to be at higher risk as well. So those are the ones that you kind of have to look out for that kind of have that. But again, I think it can kind of affect anybody that's in that situation of actually having COVID-19. So diagnosing it's kind of hard for the provider because it really requires a thorough medication evaluation to rule out any other conditions. We're talking about chest pain, heart stuff, shortness of breath, lung things, brain fog, cognitive issues. I mean, there's just so many different roads that these docs would have to explore to be able to really nail this one down and everything like that. So the docs are really going to rely on a patient history and then any symptoms, patterns that they have to be able to actually diagnose this. And so being, upfront and trying to remember, it'd probably be helpful if you had dates almost written down of the certain symptoms or what was happening and maybe after what event or thing that was happening there. So, yeah. All right. So, impact on our daily life. So if you can just imagine, there's a lot of different things that can happen with that. And so long COVID can impact your daily life, making it difficult to work. Because if you don't feel well, you're not going to go. Exercise is going to be totally out of the question if you don't feel well at all. Engage in social activities. You're not going to want to hang out with friends if you can't breathe, if you feel like your heart's going crazy, and if you can't think. So there's a lot of things there. There's some mental health issues that can come with this as well, just like everything else. So you got anxiety and depression are very common in this kind of thing just because of everything that's happening, and then you're pulling yourself away from your support group and your family and everything like that. So it kind of makes it double hard. So something to definitely focus on and try to recognize and then get the help that you need at that particular moment in time. So management and treatment. So manage your long COVID involves addressing individual symptoms, multidisciplinary approach, including physical and occupational therapy may be something that you need to help kind of get everything fixed that way. And then necessarily to help patients regain functions and improve their quality of life. So really it's an individual type of thing, and there's so many different avenues like we talked about, and just like everything else, just takes time. And I do think that physical therapy really can help out in occupational therapy, and people could benefit from that a lot more often than what they probably do. So look into those type of things to kind of help you get back on track. I've been also finding out with a lot of these things, there's a lot of support and groups and resource groups to help different people in these situations. The internet's got a lot of amazing things, got a lot of bad things, but a lot of amazing things too. And so really reach out and see what you can do to be able to kind of figure those things out and find the support that's there. People going through some of the same things. Sometimes just having a friend in that situation really can be helpful and really can help out with the mental health and just kind of keep things going and taking care of yourself that way. So, okay. So there's going to be some research. I don't really know how much there is now, because it does seem like a lot of attention has been taken away from COVID-19, and we've just lived our daily lives. We've gone right back into whatever we were doing before. We're feeling the effects still with, I'm not going to get political, I'm not going to get economical kind of thing, but I mean, I think it's very poignant to say that it still has a huge effect. We're feeling the shock waves from this, and we'll feel those for years to come, maybe decades. I don't know. I guess I'm not an expert at that, but it's things that we're still having to work through. So, but I don't think there's as much research going with this. And so, there probably is some, and I should do a little more looking into that. So I think they'll be able to figure out a little bit more promising fixes to those and kind of get going with that. So it's a complex condition. There's a wide range of symptoms. Again, talking to your doctor and getting things kind of figured out is the best way to go. And I think that just realizing that there are a lot more resources and everything out there that's really going to help out and get you going a lot more. So, all right. Well, I appreciate your time. We'll be actually underneath the 10-minute mark here. Maybe I'm just getting a little bit better at it and not putting so much in on all this. But if you like this, go ahead, subscribe and share and comment in the comment section below. And we'll be able to have any kind of discussions that you want and try to get things more open to figuring out what the best way to educate yourself on all these different respiratory diseases and making yourself healthier. If you're in school, put down what state you're in, and we'll see how many people we can, kind of pinpoint on a map and everything like that. So, all right. Well, thank you so much. Have a good night, and thanks for tuning in to another 10-Minute Learning with Brandon. We'll see you. Bye.